As you know, in patients with cardiovascular disease or hypertension, there's some increased risk of plaque forming in the arteries, and so that the blood flow to the sexual organs are also compromised, and that can manifest itself as a dysfunction in the sexual arena, as erectile dysfunction.
Heart disease is the number one thing that I find with most men with erectile dysfunction.
A patient with cardiovascular disease or heart disease is 2 times more likely to have erectile dysfunction than the normal population. A person with hypertension or high cholesterol levels, these are all conditions in which erectile dysfunction can occur at a higher rate than somebody in the normal population without these conditions.
And that's one more good reason to treat high blood pressure, not just because of the impact on a man's overall health, but his ability to have normal sexual function.
A lot of men don't like to go see physicians, so they'll come in looking for that magic pill that may help them, back to their younger days. And what we end up finding is that they have high blood pressure or potentially other risk factors. They're a little bit overweight, they smoke. And so we will try to encourage that patient to see a primary care physician or a cardiologist to be evaluated for that. Certainly if they have any chest pain, angina, those type of things that, that we have in our screening, we would not even prescribe medications for that gentleman until they had clearance.
Part of the problem is that sometimes the medicines used to treat high blood pressure also cause erectile dysfunction. But it sort of the damage might already be done at that point, and it's kind of hard to reverse it if you treat the underlying disorders. Now, treating the underlying disorders, it's going to save your life, but it might not fix your erectile dysfunction.
You may be able to treat the hypertension differently so that the medicine that's treating the hypertension doesn't have the side effect of erectile dysfunction. But I don't think in and of itself that just the initial treatment is going to make your erections as good as when you're 20 years old. Now, in the long term, I think there is a significant benefit to treating and controlling hypertension to maintain what erectile function you have. Think if a gentleman has hypertension and just says, I don't care about it, I just want my erections treated. Those erections that may be better with the medicines now, the pills now, may not be as responsive in 5 years because the hypertension is added to the problem that gave him his erectile dysfunction. So I think there's 2 answers to that. On the short term, just treating hypertension probably does not improve erections right away, but on the long term, it certainly can have an effect at keeping what erectile function you do have.